The following program is intended for the orthodontic team to increase their understanding of the OrthoCAD IQ system and provide a step-by-step explanation of the OrthoCAD IQ chairside bonding technique. The OrthoCAD IQ system is a state-of-the-art bracket placement system. With OrthoCAD IQ, brackets are optimally placed, resulting in fewer repositionings, less wire bends, and reduced office visits. This means both the doctor and the staff have less stress and more time to do other important things in the office, including starting new patients. Here's how OrthoCAD IQ works. Once you take the PVS impressions of your new patient, you send them to the Cadent OrthoCAD facility. Impressions are poured up, and the stone model is scanned by a computer to create a 3D model. Brackets are optimally placed on the 3D model based on the computer algorithms and the orthodontist's preferences. The orthodontist then uses the 3D model to generate the treatment plan. Physical IQ transfer trays are then fabricated from the model. Once this process is completed, the IQ transfer trays are sent to the orthodontic office for placement in the patient's mouth. OrthoCAD IQ is about saving time for you and your patients. Using OrthoCAD IQ, you can reduce the bonding appointment time by as much as 30 minutes or more. And because the staff is preparing the teeth and seating the tray, the doctor doesn't have to spend so much time doing the individual bonding. As you use the IQ system, it's very important to follow the recommended step-by-step clinical process to optimize the benefits of IQ. The following describes the chairside technique for applying the OrthoCAD IQ trays using the light curing method. It's always a good idea to check your curing lights to make sure you have the correct light intensity. Along with setting up all of the materials you'll need for the actual bonding, we always recommend you prepare the IQ trays before the patient is escorted to the chair. To prepare the trays, place a drop of the sealant in the IQ white plastic container provided with the patient's IQ trays. Dip the microbrush into the sealant, then dab the back of each bracket lightly. Do this for both trays. One dip of sealant should easily cover one arch. If you use too much sealant, you'll end up with excess flash. Once you complete this step, take a dry microbrush and go back over each bracket, rolling off any excess sealant. Don't worry, there'll be plenty of sealant on the bracket to have a strong bond. Next, apply the flowable composite material. Cover from the mesial to the distal on the gingival third of the bracket. When you've completed this step, place the upper tray in the orange OrthoCAD light-resistant retainer case. Then, place the lower tray on top and close the case. Due to moisture control, we always prepare and seat the lower arch first. Therefore, the lower tray is on top. So far, you've only spent about 3 minutes preparing the IQ transfer trays. Now it's time to escort the patient to the dental chair. Once the patient is seated, begin to pumice the patient's teeth, being careful near the gingiva to prevent gingival bleeding. It's imperative that you don't use any polishing products with glycerin or oil, because this will contaminate the tooth surface and will likely cause a bond failure. If you're using pumice, please only use water as the mixing agent. Next, rinse the patient's mouth chairside. It's important to rinse the teeth well to remove all of the polishing agent. The dry angles and dry field system help maintain a dry area in the posterior. Place the dry angles by positioning the blue side towards the cheek and the arrow towards the posterior. Then, place the dry field system by positioning the cheek retractor and your choice of tongue guard. It's always helpful to explain each procedure to the patient and show them what's going to be placed in their mouth. Use an air-water syringe to dry the lower arch. Blow the air towards the gingiva so that all the moisture is off of the tooth and away from the site. Be sure to dry each tooth completely. This will be the only time you dry the teeth with the air-water syringe. Once the teeth are dry, the etchant is ready to be applied. The entire arch must be etched within 30 to 45 seconds using a microbrush to apply the etchant. Be sure to keep moving during this process. Please be sure to etch the entire facial surface of each tooth, then rinse with water for 3 to 5 seconds per tooth. Thoroughly rinsing each tooth is very important. After the rinsing is completed, take the high-vac suction and run it along the tissue and the outside of the cheek retractor. This removes as much moisture as possible. Then, use the warm air tooth dryer to remove all micro droplets of moisture and to obtain the desired frosty surface. Do not use the air from your air-water syringe because micro droplets of water and oil from the compressor can potentially contaminate the teeth, reducing bond strength. The warm air tooth dryer is very effective at drying the teeth. Once the teeth are dry, you're ready to place the sealant. Use a microbrush to dab each tooth with the sealant. After sealing 3 to 4 teeth, reapply the sealant to the microbrush and repeat every 3 to 4 teeth. It's important to dab the teeth when applying the sealant to prevent damaging enamel rods. The enamel rods exposed during etching are very fragile and can break if the sealant is not dabbed properly. If you run the brush across the tooth, you may break these rods, which can prevent a good bond. By using a dabbing motion, the sealant rests on top of the rods and circumvents this risk. Avoid any dragging motion, especially when you get close to the gum tissue. You do not want to pull any saliva onto the tooth. Although this is not time sensitive, it is important to keep moving to minimize potential moisture contamination. On the upper tray, you'll notice a place mark at the midline, while the lower tray has a red mark at the midline. When you're placing the lower arch in your patient's mouth, use a straight in and straight down motion. When you feel the tray seated in the mouth, take 2 fingers and push all the way around to make sure it's secure. Take your index and middle finger to hold the tray in place, with your thumb placed under the patient's chin. Make sure there's even pressure on the tray, including the anterior teeth, so that the tray does not lift. The curing process is next. Cure the molars first. Do the 6 and 7 on one side, and then the 6 and 7 on the other side, curing from the occlusal surface for 5 seconds per tooth. Once you finish the second side, you can cure the rest of the teeth for 5 seconds each. Then remove your hand from the patient's mouth. Please be sure to use the light shield on the curing light or protective eyewear. Repeat this same process for 5 seconds per tooth, with the light coming from the gingival buccal aspect. Now it's time to prepare the upper arch. Use the air-water syringe and dry off the upper arch. Then, repeat all the steps that were performed on the lower arch. Etch 30 to 45 seconds for the arch. Rinse completely 3 to 5 seconds per tooth. Use a high-vac suction to remove excess moisture. Dry with the warm air tooth dryer. Seal with a dabbing motion. Seat the IQ tray and cure occlusal and gingival as you did before. At this point, you may remove the entire dry field system and dry angles from the patient's mouth. If needed, use water from the air-water syringe to loosen the dry angles. Now we're ready to remove the hard trays. To do this, use a scaler to lift the hard from the soft tray, starting in the posterior area. Once you have the initial separation of the 2 trays, use your fingers to remove the hard tray completely. The only thing left on the teeth are the soft trays. Repeat the entire curing process again, 5 seconds occlusally per tooth and 5 seconds gingivally per tooth. To avoid confusion, perform each step in the exact order as you did the first time. Always start each step on the lower arch because the lower arch is more difficult to keep dry. After the curing is completely done, lift from the lingual in the posterior to release the tray. Peel the soft tray along the incisal edge of the teeth, keeping equal force on the buccal and lingual. Don't pull too hard, but use an adequate amount of pressure. Now that the trays are off, remove any flash and check interproximally with floss. After the bonding procedure is completed, you may want to bring the doctor over to talk to the patient as the final step. The patient will feel like everyone is a part of the process, and this gives the patient the opportunity to ask the doctor any questions. Reducing doctor chair time is only one of the many benefits of the OrthoCAD IQ system. You'll see better management of unexpected appointments, improved office scheduling, less treatment time, and an enhanced patient experience. Better time management for doctors, staff, and patients. We're sure you'll be pleased with OrthoCAD IQ. If you have any questions or comments, please don't hesitate to call or email us. We'll be more than happy to get back to you regarding any issue you may have. OrthoCAD IQ, creating the perfect bite.